So let's try to understand tricuspid atresia with the help of this line diagram, and trust me, it's going to become really simple. So basically what is happening in this disease is that the tricuspid valve, which is between the right atrium and the right ventricle, has undergone an atresia, which means it is non-existent, and so there is no passage for the blood to go from the right atrium to the ventricle. So as soon as the baby is born, the blood is going to rush into this right atrium, but because there is a patent foramen ovale between the right atrium and the left atrium, the blood is directly going to jump into the left chambers. And remember, this is the deoxygenated blood that is entering the right atrium, and it's all going to get pushed into the left side of the heart, and it's going to enter the ventricle and get pushed through systemic circulation and reach all of the body. So basically what is going to happen is there is going to be an immediate cyanosis, because one, the blood is not going into the pulmonary artery, and because of this there is no oxygenation occurring at all, and whatever deoxygenated blood is there is directly going into the systemic circulation and is going to spread to all parts of the body. So the baby is going to be presenting to you with immediate cyanosis, right? So this is the main problem in tricuspid atresia. So how do we treat this? Well, to give some temporary relief, what we do is we keep the ductus open, which is this part over here. This is the ductus arteriosus, which is a connection between the aorta and pulmonary artery. So basically when you keep this open, the blood has an alternate channel to go into the pulmonary artery, and it will go to the lung and get oxygenated and come back and enter the left atrium once again. So at least there is some oxygen in the blood by keeping this ductus open, right? So that is what we're going to do. But to achieve that permanent solution, what we're going to do is we're going to do a shunt, and this is called as the Glenn and the Fontaine shunt. The Glenn shunt is directly a shunt between the superior vena cava and the pulmonary artery, while the Fontaine shunt is a shunt between the inferior vena cava and the pulmonary artery. So basically you are bypassing the right chambers of the heart, and the blood coming from the rest of the body is going to go directly into the pulmonary artery and onto the lungs to get oxygenated. So that's how you treat tricuspid atresia. And thanks for watching, and subscribe and stay tuned for the next video.